Hi, and welcome back to Antai Hospital's YouTube channel. And today's topic will be diving into the classification of miscarriages. Now, as with all sciences, regardless of which field of sciences, we usually begin in this discussion of classifications, and then only we better understand the topics. The classifications of miscarriage is very important because it helps doctors and nurses and hospitals to easily diagnose what is the cause behind your uh, miscarriage, your recent miscarriage, or if you have multiple miscarriages. It can save a lot of time for our end here, and we can easily, accurately diagnose just by simply listening to your medical history. So, miscarriages in general, there are two types in depending on when they happen. So if you classify them depending on when they happen, there are only two types. So the first type is an early miscarriage. Now those who have experienced the miscarriage, they themselves will know this type of classification. Early miscarriage, the next one is a late miscarriage. Early miscarriage happened from week 1 all the way till week 12, which is the first trimester, the first 3 months of pregnancy, which is also the most common time when miscarriages happen. Over 85% of miscarriages happen within this 12 weeks. So please pay attention, and you can also figure out certain clues and hints behind your miscarriage history as well. So for late miscarriages, it happens from week 13 all the way until week 28. So I'd like to repeat myself again. Week 0 or 1 all the way to week 12 is early miscarriage. Week 13 all the way to week 28 is late miscarriage. Now, early miscarriages are much more common. Late miscarriages happen as well, but only 15 to 20% of the time. 1 out of 5 miscarriages end in late miscarriages. So any miscarriage or pregnancy loss or early birth after 28 weeks, it's no longer a miscarriage. We usually call that a premature birth. It's a different case entirely, no longer classified as miscarriages. Now we know these two classifications. There's another two classifications as well, depending on the nature of the miscarriage itself. So firstly is a primary miscarriage. Secondly is a secondary miscarriage. So what does a primary or secondary miscarriage mean? It simply means, like, let's say primary miscarriage, let's start with that. Primary miscarriage is that you have no history of pregnancy at all. You have never given birth. You have tried multiple times, but there's no history of healthy pregnancy. You did not engage in induced abortions. There was no prior history. This was your first pregnancy, and it ended in a miscarriage. This is a primary miscarriage. No history of healthy pregnancies at all. You have not given birth at all. That's primary miscarriage. Secondly is a secondary miscarriage. What is a secondary miscarriage? It's opposite to what the primary miscarriage is. Secondary miscarriage means you've had a history of healthy births. You've had children. You've had 1 or 2 healthy pregnancies, but suddenly you've started experiencing miscarriages. It could be one, it could be several, but the main thing is that you have had experience of healthy pregnancies full term, and you've given birth to children, or you've had healthy pregnancies but you've decided to go for an abortion. This is also still considered secondary miscarriage. So with these two types, the early, late, and the primary, secondary, you can combine these two categories into ultimately 4 classifications of miscarriage. Firstly is a primary early miscarriage, secondary early miscarriage, primary late miscarriage, and a secondary late miscarriage. These 4 are all the classifications that you'll ever need to know about miscarriage. So when we go about diagnosing patients, we simply talk about their medical history, and we can easily tell which of the 4 categories they belong to. So when we start from primary early miscarriage, usually the culprits is easily distinguishable for doctors. If you are a primary early miscarriage, very likely you have some form of uterine malformation or some problems with the ovaries. These 2 factors are very common. So we do not need to waste any more time on other diagnosis. We can immediately dive into the problem and ensure you have a healthy recovery, effective treatment, you can go into a healthy pregnancy. So if you're talking about secondary early miscarriage, primary culprit, the primary cause is an immunity factor. An immunity factor, we've discussed this many times now. Immunity factor is when the maternal immune system generates anti-embryonic antibodies that tends to attack the fetus, tends to attack the embryo, causing repeated miscarriages. Now this is an acquired factor, unlike early primary early miscarriages. Unlike those are congenital factors, you are born with it. But for secondary early miscarriage, you acquire this immunity factor, usually from multiple induced abortions, introducing these fetal tissues into the mother's system, developing these antibodies. So it helps us in diagnosing you accurately. So moving on, when we talk about primary late miscarriages, very similarly, these are usually factors that you are born with, that is out of your control, that is not acquired. So primary culprit for primary late miscarriage is a short cervix or an underdeveloped cervix. These are all diagnosable and treatable. When a short cervix is present, usually it leads to a late miscarriage because it's far too short to sustain the weight pressure of the pregnancy, and it will get shorter and shorter throughout the entire period of gestation until there's no more length left, and it causes a premature dilation leading to the late miscarriage, and it is also treatable. And the last group is the secondary late miscarriage, which is also an acquired form. Usually it is acquired from either birth, you have a history of giving birth causing some tear, trauma to the cervix, causing cervical insufficiency. And another factor is that you've had a history of HPV infections or cervical cancer where you went for treatment, surgical removal, or cervical conization of parts of the cervix. Then this can also cause cervical weakness, cervical insufficiency. So it's very clear for us when we categorize you based on these 4 categories, and we can immediately identify the cause behind your miscarriage. But your role as a patient is that you need to be very transparent, very clear with your medical history, especially when you're talking to your doctor, your physician. Because if you are not clear, we may classify you into a different group, and we may be wasting more time in trying to properly diagnose your problem and help you. Remember, our duty is not to share your personal information, but to secure you healthy pregnancy. Because certain couples, they would like to withhold some information because they've had previous pregnancies with another prior spouse or another man, so they wouldn't like to disclose this type of information. But you need to understand, if you do not disclose this information, it can cause error and misdiagnosis, causing waste of time and wrongful treatments. So your duty is to be transparent, fully transparent to your doctor, and the doctor's duty is to be 100% protecting your privacy. There will be no leakage of these types of information if that's your concern. And that's our practice here at Antai Hospital as well. So I hope in this video you've learned some of the classifications that we like to teach our patients, and also you can help identify yourself as to which group you belong to. And remember to share your full medical history to ensure that you receive the proper treatment diagnosis that you need. Antai Hospital provides treatments for recurrent miscarriage, miscarriage alike, and for those struggling to get pregnant. Please visit our website, leave us a comment down below, and also set up a consultation if you'd like to talk to us directly regarding your miscarriage problem. We can definitely help you with our years of experience and expertise. Please stay tuned to the next video.